A very good morning and welcome to The Nation. I'm your host for the day, Tamina Kausji, and today we have with us in the studios Dr. Kannappan, who is consultant obstetrician, gynecologist and fertility director, currently with Sunway Medical. So, welcome to the studio, doctor.
Very good morning. Thank you.
Thank you for coming in. All right. So, basically today what we were going to be talking about is in vitro fertilization, or more commonly known as IVF.
Correct.
All right. So before we get started, as you were telling me before, IVF actually falls under a branch called ART, or Assisted Reproductive Technology.
That's right.
Okay.
Right. Now, basically when we look at ART, we are looking at things like IVF. Okay. We also have things like ICSI. Okay. These are all different technologies that we use to help couples conceive. And most of this is actually done in the laboratory.
Right.
Done by the embryologist. Okay, so it involves highly skilled personnel. These are whom we call as embryologists, as well as highly skilled equipments and a lab. So the cost is quite tremendous because you need to spend a lot of money to invest and have a proper lab and have these people establish the lab and have these people trained. And people like myself, we are clinicians, okay, who provide these facilities to the patients.
Right, understood. So basically IVF, I mean, I think the common parlance would be people saying that, oh, it's a test tube baby. Is it right to refer to an individual born of...
Okay, it's very nice to put in a cartoon and say that there is a test tube baby.
Right,
but actually what we are dealing with embryos which are in a cell stage.
Right.
All right, they have not actually formed into a proper fetus yet. Okay, and what we are transferring is basically an embryo which is within the 3rd or the 5th day of development.
I see.
And it really needs to implant onto the mom's womb before it actually goes on to form a fetus.
Right. Okay.
So to say that test tube baby and to think that there's actually a baby inside a test tube,
exactly, because
and you can actually choose the babies you want, no.
Not at all.
Not at all.
Okay, so just to dispel that common myth.
That's right.
Okay. All right. Now, well, when we think of IVF, and if we look at it in a Malaysian context, I think one could be forgiven for thinking, oh, I don't think Malaysia needs IVF. I mean, look at our population, abundant, growing, vibrant and youthful.
That's right.
So what would a fertility specialist like yourself have to say for that?
Okay. There are a lot of things that we hear when we really need to break down and discuss.
Right.
Yes, when we look at our population is growing.
Yes,
you
indeed.
must understand that health facility in this country has improved tremendously over the past 50 years.
Right.
Right. Maternal mortality, that is mothers dying during delivery, has dropped tremendously. We have done very well in improving mothers' health, overall health, including health of those who are elderly, elderly patients. So in those days, I mean, if you look at age, I mean, the lifespan now, it's going right up to 70 to 80 years.
Yes,
so
indeed.
that is one of the reasons why you actually see the population which is actually booming. All right.
True enough.
Now, when you look at the younger, the children who are born, again, our health facility is very good. So most babies whom are born or children actually make through their childhood life.
The viability rate is higher.
That's right. When you compare to countries like Africa and all, where most of these children are affected by infection and everything
early
else.
viruses.
That's right. And then they succumb. So in overall, our population is doing very well, basically because our health facility has gone up tremendously, improved.
True.
But if you look at fertility, we are dealing with couples who have difficulty conceiving.
Right.
Okay. So you need to differentiate that. And we are seeing more and more of these couples. At this moment, we anticipate or we predict that there could be this problem could be encountered by 10 to 15% of married couples.
I see, 10 to 15%. That's an enormous number.
That's quite a big number.
Yes.
Okay. And the reasons are many. Right? The reasons are many. Nowadays, I'm sure men and women, want to establish their career before they consider marriage. So in those days, women, the average age of marriage was between 16 to 18, 50, 60 years ago. Right now, it has gone up to 28. Okay, and for certain women, they want to complete their career.
Yes, it might even
and
go.
it may even be a bit later. I have patients who have married at the age of 38, 39, and then they are contemplating on a family.
True.
So you must understand, for a lady especially, when she delays her age of marriage, all right, her chances of pregnancy also drops to some extent.
Yes.
Because the quality of the eggs and the egg reserve actually drops with age.
Right. So year by year there's
year by year there's a drop. So if a lady gets married at the age of 28, her chances of conceiving in 1 month is around 25%.
Right.
While at the age of 38, it drops to around 12 to 13%. And at the age of 42, it even drops to around 3 to 5%. So you can see there's a drastic drop.
Yes, the window gets narrower.
That's right. That's for women. For men also there are issues.
Right.
Okay. So if you look at it, there are many compounding factors. Okay, which are actually affecting a married couple. All right. And therefore fertility is becoming an issue. And I personally feel that all these couples should come forward and seek treatment.
Right. Okay. Because basically what's happening is, so would you say in a sense that fertility issues are more of an urban syndrome of sorts?
Not 100%, but it seems to be much more common in the urban population. In the suburban group, there are couples who are marrying late,
right,
and they do have issues. In the younger patients, they could be having issues because of other medical problems.
Right.
Okay. So you have different sets of patients who need treatment. But yes, I would feel that it could be more common in the urban population.
Right. Okay. So basically, run us down with what would typically happen with a couple who decide that, all right, we seem to be having a problem conceiving.
Sure.
Let's go to a fertility center.
Sure.
So what happens next?
Okay. Now, what we do tell patients is they must have tried at least for a year.
I see. All
they
right.
must have tried at least for a year, provided that they do not have any problems. So problems meaning that they don't have any prior medical illnesses, surgeries done for either the men or women. They are able to have a normal sexual intercourse,
right,
and the lady has regular cycles. Okay, if all these issues are not a problem, that means they don't have any issues here, then generally we encourage these couples to try for at least 1 year before they seek treatment. But then again, as I told you, it also depends on the lady's age. If she is 28, yes, we would ask them to try for 1 year. But if she is marrying at the age of 42 or 43, waiting for 1 year may not be advantageous.
Might actually be detrimental.
That's right, because egg reserves are going to drop.
True.
So if it is a young married couple, they don't have any issues, then they should actually continue to try for a year.
Right.
After a year, they should actually seek some advice from any gynecologist for that matter.
Right.
Basic investigations need to be done. For the husband, it has got to be a semen analysis where we are looking for presence of sperm, count, motility, viability, those type of things. And for the wife, basically we just need to ensure that her eggs are actually coming out or she is ovulating.
Right, and a proper cycle.
That's right.
Okay.
Even though she's having a regular cycle, she may not be ovulating. So those are
That's
issues.
an important factor.
That's right. That's right. So that's why after a year, they can actually see any gynecologist, and these are 2 tests that will be done.
Right.
Okay? You must understand, males and females both contribute to infertility. So it is not a women problem.
Very true, and thank you for stating that.
I need to specify that because in my set of patients, or generally in most fertility centers, we find that 40 to 60% of males have issues.
Right. Okay.
So we generally say it's 50-50. Basically, that's right. So we look at both these parameters. If both these parameters are okay, then the gynecologist will advise them what to do further. All right.
Okay.
So if this young couple, in that first year they have been trying, approximately 80% would conceive.
Okay. All right.
So we are only investigating the remaining 20%.
Yes, 20-odd%,
right. And this 20-odd%, if they've done these 2 investigations and it is normal, then another 5 to 10% of that 20%, that means 50% of that would actually conceive in that year.
All right.
And I personally would like to see only those who have not conceived in that 2 years. That means from therein. That's right. So we are looking at a subset of patients of maybe around 10 to 12% who have actually done all this and yet unable to conceive, and then they come and see us.
Right.
Now, when they do see us, we actually go through, take a full history again, find out all these issues, you know, and try to address it at that level. There could be a lot of factors that could have contributed, and if these are correctable factors, then we would rather correct them, okay, then see whether they are able to conceive. If they are unable to, all right, then we look at assisted techniques.
What's an example of a correctable factor, as you quoted?
Right, correctable factors would be like a lady is having a cyst. We call it like an endometriotic cyst or a chocolate cyst, all right, where she could undergo surgery, have the cyst removed, you know, and then her tubes assessed, and if all that is fine, then she could have a good chance of conceiving. Okay. Other things would be, again, tubal factor. Tubal factor means women have 2 fallopian tubes.
That's right.
Sometimes these fallopian tubes could be blocked, okay,
or a so-called lazy fallopian tube.
Lazy fallopian tube, maybe that would be difficult to prove.
Right.
Okay, but usually when we look at the fallopian tube, we are looking at it from a mechanical point of view.
Right. Okay.
Seeing whether it is open, whether it is stuck, you know, those type of things. And if it is stuck, we could attempt to release it.
Yeah, there are procedures which
that's right. We could do it laparoscopically, which is keyhole surgery.
Keyhole, yes.
And I basically would do the surgery and try and see whether we can reconstruct these tubes.
Right.
Okay. And these are all factors that we can do to assist natural conception.
Right. Okay. So far, actually, what we've been talking about is going into IVF. It hasn't touched IVF yet.
No, we have not touched IVF yet.
All right.
So these are things that we as fertility specialists could help them. Now, if let's say we find that there's no issues at all, there's a subset of patients who will actually have everything, all the investigations are perfectly normal. They have done their blood investigations, it's normal, the semen analysis is normal, and we also do either an X-ray or a keyhole surgery to check the tubes, and that is normal.
Right.
And we just can't explain why they're not conceiving, you know. And when we have situations like this, we offer something a bit more advanced than natural conception, where we talk about intrauterine insemination.
Okay. All right.
So here basically what we are doing is we time, you know, we ensure that the lady's egg is ready and she's about to ovulate. We give medication for the egg to come out.
Right.
We will collect, my embryologist will collect the husband's sperm, process it, concentrate it, just take out the moving motile sperms.
Right.
And what I will do is basically take the sperms and place it into the lady's uterine cavity.
Okay.
Okay, so it is an outpatient procedure.
All right.
Right? Patients where they come in, they just have the scans done, you know, and they have the insemination done, and then they go back home.
Right.
So what we have done actually is it's natural.
It's natural.
It's natural, but we have made sure that we are maximizing.
Yeah, maximizing the success rate.
Success rate. That's
All
right. So this we call as IUI.
Okay, and what are the typical success rates of IUI procedures?
Right, IUI success rates are around 12 to 15%.
All right.
Okay, you must understand natural conception is only 25%.
Exactly, 25%. So that's a huge success rate actually.
This is considered pretty good because we can achieve at least 50% of that.
True.
We would try this maybe 2 or 3 times.
All right.
Okay, and
what is the usual time cycle between? Actually
depends on the lady. She can actually do it every month if she wants.
All right.
Okay, but we tell them try to do it as soon as possible.
Right.
Without too much of a delay, because so most patients would actually do this 2 or 3 cycles of IUI within 6 months.
To ensure the quality of the eggs as well.
To ensure that the lady doesn't age.
True, biologically
speaking. Correct.
All right.
So failing of this IUI, or let's say we have found other factors, significant factors in a lady, example, her tubes are totally damaged.
All right.
And we are unable to do anything about the tubes, so we now have no choice but to collect the eggs, that's in like IVF.
Right.
Or we find that her age is caught up significantly, or she has been having some of these recurrences very often, you know, and her ovarian reserve is dropping.
Okay.
Or we find that the males are actually having significant male factor. That means the sperm count is actually very low, all right, and natural conception is going to be difficult. So if you have this group of patients, then we will actually look at doing IVF for them.
Okay. All right. So very interesting so far. Thank you, Doctor. And we'll come back shortly once the break is done to discuss a lot more about the issues concerning IVF and its status and growth in Malaysia. Stay with us.
Isu semasa dan terkini industri kreatif tanah air. Perkembangan muzik tempatan, lensa anak seni, aksi layar perak, tanpa gosip dan sensasi, semuanya disisipkan selama setengah jam dalam Teddy Sini bukan sekadar hiburan. Setiap Sabtu jam 12.30 tengah hari hanya di Bernama TV.
Kavita, mailing dah set ke belum?
Sikit je lagi, Puan.
Apa menu kita hari ni?
Semua menu sihat. Ikan bakar, sup ayam, sayur-sayuran. Banyaklah.
Puan, banyaknya guna minyak. Bahayakan kesihatan lah.
Betul lah macam ni. Saya dah kurangkan separuh dari biasa ni.
Cuba rasa ni. Sedap tak?
Biar kurang masin, jangan lebih.
Betul tu. Kita kena kurangkan minyak, gula,
Garam dan santan dalam masakan. Barulah ramai pelanggan datang ke kedai kita.
Semuanya
sihat belaka.
Menyelami realiti, menjejaki masa, meninjau peristiwa, paparan kronikal kembara kehidupan, pelbagai keunikan juga pengalaman menarik. Segalanya disorotkan selama setengah jam dalam channel Bernama setiap Ahad jam 9.30 malam hanya di Bernama TV.
Welcome back to The Nation. You're here with me, Tamina Kausji, and our guest for the day, Dr. Kanappan, who is Consultant Obstetrician and Fertility Director at Sunway Medical. All right, Doctor, so as you were saying, now, so there are also factors which the male contributes towards infertility.
Correct.
What are some of those, for example?
Okay, when we look at the male factor, primarily we look at the semen analysis.
Right.
That means we ask the husband to produce the semen, and my embryologist will assess the semen quality, the quantity, and the motility. These are three main parameters they look at. But these are just parameters. It doesn't mean that if they are perfect in that they will actually bring about fertilization.
All right.
But this is quite a good indicator to tell us that the male has got a problem. Majority of the time male factors are related to this, where we actually find that the sperm counts are very low.
Okay.
Normally we take it 15 million and above per mil.
Per milliliter.
Per milliliter.
Okay.
But it's quite common to see counts of 10 million, 5 million, sometimes 1 or even none.
All right, even none.
Yeah.
Okay.
So I actually see every week one patient where he is able to produce semen, but there's no sperms.
Right. Okay.
So it's relatively common in
Relatively
this subgroup of patients.
Right.
So that
now,
is
what are some factors, just out of curiosity,
Sure.
which might actually cause this very low sperm count if it's not something that's actually endemic to the person?
one, it could naturally be low,
Okay,
all right,
naturally.
from young without the person realizing. It could also be even due to simple things like mumps infection.
Okay, mumps, the swelling of the nodes.
That's right, the
All
swelling
right.
of the glands that can happen after achieving puberty.
All right.
Right. That means if that particular man had it when he was a boy, a small boy, 6 years, 7 years, it doesn't
Right.
matter.
Yes.
But if he had it when he was in secondary school or college,
Right, post-pubescent.
That's
meaning.
right.
Okay.
this type of viruses can also cause the testis, affect the testis,
I see.
and actually kill off the sperms.
All right.
Okay. Trauma, that means injury to the private part. Maybe it's a football injury or a motor vehicle accident, those type of things. And quite a number of them do not even realize that they have absence of the testis.
Right. Okay.
Currently, it is a common practice that after delivery, all the newborn babies are examined by the pediatric doctors.
Right.
30, 40, 50 years ago, you know, it depends on the center where they were born. All right.
True enough.
So quite a number of them do not realize this until they actually come and see me. You know,
Right.
when we do an internal examination for a man, then we realize these problems.
Because they were never informed at
That's
birth.
right. That's
Yeah.
right. They never descended. That means they were.
Okay.
For men, it is supposed to descend into the scrotum, and it never happened.
That's right.
There can also be other issues like varicocele. That means they have excessive blood vessels in the scrotum.
Okay.
Okay,
All right.
and these blood vessels increase the temperature and break down the sperm count.
Heat, basically.
That's right.
All right.
And when we're talking about heat, any occupation that is
Yeah, I was
heat-based,
just going to say
that's-
occupational hazards.
That's right. It can happen.
Right.
Things like a person working in a steel plant exposed to excessive heat.
A chef, for example, perhaps.
That's right. Working in a
Possibilities.
stall, long distance drivers who are always
True.
on the seat. Okay. People who cycle long distance.
Right,
okay.
cyclists, yes.
That's right.
Clothing also might play a factor, perhaps.
May. So this is
Okay.
where we actually, when we see these men, we ask them to wear loose boxer shorts at home. You know,
Right.
don't go to the spa too often. Hot baths are fine, but don't sit in a hot tub for too long.
Right,
You know?
okay.
This type of things can
Lots
also,
of common sense measures.
yeah, may help. All this
Okay.
may help to improve the count. But if the count is actually very low, there's nothing much we can do.
Right.
All right. The other things that they also need to know is things like chemical exposure,
Okay.
pesticides.
Chemical exposure. So, but I think that would be an average concern overall. I mean, how do we, in that sense, help ourselves or, protect ourselves against chemical defenses?
It is an issue, especially with the changing in environment. Right now, the things, the utensils we use, it's all made of plastic.
That's right.
There are a lot of chemicals we're actually taking in every day without
Even in
without
our daily
realizing.
food, for
That's
example,
right.
bread, even milk, all the additives that are in basically everything that you consume.
It has got a lot of hormones and
True enough.
chemicals inside, which will have a long-term effect. Some even talk about handphones.
Right, yes, radiation, etc.
The exposure of that. And like I was in Cleveland 2 years ago, and they actually have done studies, where they show these handphones can have an effect.
Right.
All right. So we wouldn't know until until more studies
Yeah,
are done.
more, let's say 20, 30 years
that's
from
right,
now.
20, 30 years from now,
True.
then probably we'll look back and say these were the causes of problems. So obviously the change in environment, change in our health, in our lifestyle, all this will have an effect on the sperm count. So that is the other thing, that when we see these couples, we talk to them. Healthy lifestyle.
Healthy lifestyle.
When it comes down to regular exercises, maintaining one's body weight,
Right.
all this is actually very important. The other issue, I'm sure you realize that excessive weight gain is
Yes,
quite
I was just
common.
going to ask, is obesity some
Yes.
sort of a factor?
Yes, it is.
Okay,
It
it
is.
is. Okay.
You find that it affects whether it's a lady or the man. It affects both parties, and it affects the ladies even more.
Right.
All right. And the tendency among Malaysian women or Malaysian couples overall
Yes.
is after they get married, majority of them put on weight.
Right. Is the happiness sort of just expanding?
That's right.
Okay. All right.
I've done this study in Hospital Kuala Lumpur, and my nurses actually did the study where they actually asked the lady
Okay.
concerned, how much of weight gain. On the average, we noted that they all put on at least 5 to 15 kilos.
Right.
Some had actually put on 20 kilos, and the majority mentioned that they were happy, after marriage, right? And men also, quite majority of them did put on weight. And on the average, it was 5 to 10 kilos.
Right.
So both partners actually put on weight without realizing that all this actually affects the gametes.
The
you
fertility
the
eventually.
fertility eventually. For women, it is even more prominent. My girls, my nurses actually did a study where they actually showed that women at different BMI or body mass index.
Right.
The higher the body mass index goes up, the lower the ovulation rate.
Okay, so it's actually directly correlated.
It is linked. So once their BMI, they have become obese, all right, the fertility rate drops less than 50%
Right.
of what it could have been if they were in the normal weight. So all these factors do play an important role. So this is where we actually sit down with patients, and sometimes when they come for IVF, we actually tell them take a 3-month break first, do these corrective measures, okay, then try the IVF, then your success rate will actually go up.
Good point. In a way, reset your system completely and then see how it works.
Correct. And you'll be surprised, some of them actually come back in that 3-month pregnant.
All right. Okay. Wonderfully enough.
So I used to tell them, there, you see.
There you go.
There you go. So
sometimes I suppose it could also sometimes be just the stress of it. Correct. Because I mean, for example, especially I think it's part of Asian culture, when you're already with somebody with the intention of getting married as a couple, of course the question is already, when are you going to have babies?
That's right.
So I think that adds to the stress level of the couple. And if you're actually stressed out about when you're going to produce your first child, everyone's asking and you haven't done it yet, a year passes, more stress, so it just goes on.
And a lot of people tend to eat when they get stressed.
There you go.
And then they tend to put on weight. So
it's all about seeking that balance, I suppose.
That's right. And the stress level among these couples are usually very, very high.
Right.
Like you highlighted it correctly. Whenever they attend a function, everyone asks the same questions.
True.
So much so, I have, my own my patients come back and tell me that they're avoiding all this,
you become a bit of a recluse just because you don't know what to say anymore.
That's right.
And that's not fair at all.
That's not fair at all.
Not fair at all.
But it's across the border, all Asian countries seem to have these issues. I have patients from Maldives, I have patients from Indonesia.
Right.
And they're actually coming here to seek treatment because they do not want their families back in their country to know about it.
Right.
And they want a break, because they say the stress levels are so high back home.
Oh my, okay.
So it is
to
across
that
the border.
extent.
Yes, it is. It is. And I sympathize with them.
Yeah, understood. I mean, it's not exactly a thing that should even be up for discussion, but we're not often that discreet, I suppose.
That's right.
All right. Okay. So all that is the steps taken before a couple actually takes the big leap into opting for IVF itself.
Correct.
Now, let's say all of these options have been exhausted and they were still not successful.
Yes.
So then that's when they actually commit to IVF itself.
Correct.
Now, what does that involve?
Okay. Now, as I mentioned before, IVF is one entity that we actually do in the lab. So we actually say it's ART, assisted reproductive technology.
Yes, ART, that's right.
And what encompasses in an ART, whether it's IVF or ICSI, is basically for the lady, we are giving her daily injections.
Right.
All right.
Daily injections.
All these injections are right under the skin.
Okay.
And they usually come in a pen form. The medication comes in a pen form.
I see.
So for comparison, it's just like insulin injections taken by diabetic patients.
Right. But they are administered, not self.
They can be self-administered.
They can be self-administered.
We can actually teach the patients how to do it, and they are taught, and they have to, if possible, we would encourage them to self-administer themselves.
Right, of course.
And what I myself as a clinician would do is I would see them on their second day of their menses.
Right.
Do a routine ultrasound, do some blood investigations to make sure that everything is fine, start them on this treatment, and I usually see them back after maybe 5 days or 6 days.
Okay.
And then I would repeat the ultrasound, and then also at the same time, if needed, blood investigations. So here what we would do is we are assessing the egg growth.
I see. Okay.
In a natural cycle, you would expect one egg to grow, but here what will happen is we are aiming to collect more. So we
from
are
the stimulation.
From the stimulation, correct.
Right. Okay.
So basically, these injections are like you said, it's stimulating the ovaries using drugs.
Yes.
And we are hoping to collect maybe 10 to 15 eggs.
Right, 10 to 15 at one go.
At one go.
All right.
So I would assess them on day 6 again, and then we would add on another injection, and we go on like this for another 5 days.
All right.
So totally the lady probably would have taken injections for 10 days.
Okay.
Right, and by which time we know that the eggs have come to a good size.
Right.
Okay, and once that has been achieved, then we will give them the final injection for the egg to be ready to ovulate.
Okay, to ovulate. So it can be harvested.
That's right, it can be collected. So, example, today morning I'm seeing the patient and
Okay.
she's ready. Tonight she will take the final jab.
Right.
36 hours later, that means day after tomorrow
Yeah, day
morning,
after.
she gets admitted to
Right.
to my center, completely fasted, and there the anesthetist will put her to sleep.
Okay. So it's
And,
it's a proper procedure.
It's a proper procedure,
Okay.
right? So
All
we're very
right.
particular about all this.
Okay,
And
so we'll come back after the break to be talking a lot more in detail about the exact IVF procedure.
Sure.
Thank you. Stay with us.
Pemirsa, salam dari Jakarta. Sebuah program kerjasama Kantor Berita Indonesia Antara dengan Kantor Berita Malaysia bernama kembali hadir menjumpai Anda.
Sedar tak kita tuan-tuan dan puan-puan, keadaan iklim yang tak menentu sekarang ni. Perubahan iklim meningkatkan kejadian kemarau, derebu, banjir dan ia menyumbang kepada perubahan iklim yang berlaku secara drastik. Inilah dia faktor-faktornya. Yang pertama, asap dari kenderaan. Yang kedua, penebangan dan pembakaran hutan. Yang ketiga, pembebasan asap dari industri perkilangan. Dan yang keempat, pelupusan sisa buangan. Ini usaha yang Pak Abu buat, iaitu yang pertama, menanam pokok. Yang kedua, mengurangkan atau tidak menggunakan beg plastik. Yang ketiga, mengasingkan bahan buangan. Yang keempat, mengitar semula bahan buangan. Dan yang kelima, memilih barangan dari bahan kita semula. Ada banyak lagi usaha yang boleh kita lakukan. Antaranya, kurangkan pemanduan kereta persendirian dan banyakkan penggunaan kenderaan awam.
Anda adalah sebahagian daripada penyelesaiannya.
Menongkah batasan masa, mengupas isu semasa, jadi saluran pelbagai suara, segalanya baru dan benar di Berita Bernama TV.
Welcome back to The Nation. You're here with me, Tamina Kausji, and our guest for the day, Dr. Kanapan, who is Fertility Director at Sunway Medical. All right, Doctor, so we were talking about the rigors that a couple actually goes through to get to IVF itself.
That's right.
Now, so you were telling us a little bit about, the risk factors and what it is that can be done, the procedure itself. So once the lady checks in and let's say the eggs are harvested, what happens next?
Okay, once the eggs are collected, then we will ask the husband to produce the semen, and after that is all done in the lab. So my embryologist, okay,
Right.
she will actually look at the sperm, the eggs. We only use normal eggs and normal sperms, and either they will place the sperms together with the egg, which is called
Okay.
IVF,
All
or
right.
they will decide to inject one sperm into each egg, and that is called ICSI. Okay?
ICSI, which
That's right.
stands for?
Intracytoplasmic sperm injection.
All right, so that's a lot more targeted.
Correct. It's more
Okay.
targeted. So this decision usually is made by the embryologist.
I see.
Right. And after doing that, they will actually keep the eggs and the sperm in the incubator.
Right.
And the next day they will assess, and then they will assess daily, and they will see what is the fertilization like and how the embryos are growing. And by the third or the fifth day, we
Right.
actually make a decision, all right, for the embryos to be transferred. So here, let's say we do collect maybe 8 eggs, and
Okay.
6 are normal, 6 are injected. After that, probably 4 are good quality.
Okay,
All right, and
right.
we will make a decision either to transfer 1 or 2 of these embryos,
Right.
and the other 2 we will freeze. That means these embryos can be used in future.
So that the procedure doesn't have to be repeated all over
That's
again.
right. That's right.
All
So she doesn't need to undergo the whole thing again.
Right.
She just comes at the right time, and then we will thaw. That means take them out.
Yeah, take them out of the
and
freezed
then
state.
then we will transfer.
I see.
Now, when we talk about the number of embryos to be transferred, especially my center and myself, we are very strict on the numbers that need to be transferred. The reason is, the more you transfer, obviously the pregnancy rates are higher.
Naturally,
yes. Because you have a better chance of implantation.
True.
But then again, the more you transfer, there's a higher risk of multiple pregnancy.
Okay. Yes. I think an often seen effect of IVF.
That's right.
True.
That's right. So you must understand the human uterus, is actually conducive only for one baby.
Right.
Okay. And in certain circumstances, twins are still acceptable. But once they end up having triplets or quadruplets, many a times they either have a miscarriage or they have a very early preterm labor and deliver. And most of these babies don't survive.
True. Or they have, a host of health complications.
Correct. Cost goes up because the babies have to be looked after, and like what you highlighted, they have health issues later on in life. So this is where we actually sit down and discuss with these couples, and emphasize the importance that yes, we want you to conceive, but at the same time we want you to have a healthy baby at the end of the pregnancy. So our tendency most of the time is to transfer 2 embryos.
Right.
Okay.
Yes.
Then when we do that, after that has been done, then we usually give them some medication to support the womb, and 2 weeks down the line we will know whether they have conceived or not.
I see.
Not all conceive. That's very important that they should understand. Usually we will quote it around 35 to 40% pregnancy rate. So I usually tell them, if 3 couples come in, 1 would definitely conceive.
Right. So those are basically the odds.
That's right.
Okay. So post IVF, those are the odds.
That's right. So like you had mentioned, multiple pregnancy.
Yes, multiple. And
that is a big issue. Let's say if they end up having 3 or 4, viable pregnancy because 4 embryos are transferred or something like that.
Right.
All right. As I said, all these problems of miscarriage, early delivery, and mothers are also at risk of hypertension. Other problems, medical problems, and all this comes up, so that is one of the risks with IVF.
True. I mean, pregnancy itself, it's a huge natural change. And
correct.
There's so many things that can happen.
That's right. And it becomes more because of this multiple
it's just
pregnancy.
escalated.
That's right.
Okay.
So that is one of the risks with this thing. Number 2, even though we do an embryo transfer and we place it into the womb, all right, there is still a risk of ectopic pregnancy happening in the tube.
Inside the fallopian
tube. Or even if they conceive, they can have a risk of miscarriage.
That's right. So in the case of an ectopic implantation, for example, what would typically happen?
She would need to undergo, most circumstances, she would need to undergo surgery to have the tube removed.
Because it's basically a health risk and the fetus will not develop.
That's right.
Okay.
So these are among the risk factors. The other thing that we always need to highlight is we are very cautious when we are stimulating her in the early stages. Even though we want to achieve collect quite a number of eggs, but we do not want too many eggs to form. Right. And if they have too many eggs forming, there's a risk of what we call as ovarian hyperstimulation syndrome.
I see.
Okay. So for a lady, the ovary is actually pretty small. Okay, I'm sure you know. And once it's stimulated, it will enlarge. But once it is stimulated too much, it can actually go up huge. The size of it can become huge, and there can be fluid collection in the tummy region.
All right.
Okay, we call it ascites, and in worst case scenario, this fluid can actually go into the lungs.
I see. Okay, so travel all the way up from the abdominal.
That's right. It can go into the lungs, and she can have difficulty breathing.
Right.
Okay, so these are all real complications that can happen. So this is why when we stimulate patients, we monitor them very closely, and we do not want too many eggs. At the same time, we want to achieve our target of
the optimal number.
That's right, optimal number.
So that's actually a very crucial period, the time when the hormone injections are being administered.
Correct. And each person has to be individualized. So this is where I actually see them, and assess them, and then tell them this is the dosage I'm going to start. And halfway through, sometimes we need to top it up or even bring the dosage down.
Right. Okay. So basically, it's customized according to each individual couple.
Correct.
All right. Okay. So aside from the risk of multiple pregnancy, which could turn out, either smoothly or more difficultly for the couple, what are some other complications involved with IVF?
Well, IVF, as I mentioned, they're using a lot of drugs. okay, there is always a small concern they can have some allergy to these drugs,
Right.
which are not very common. The other thing is they have been put to sleep for the procedure, which is around 20-25 minutes. There's
Right.
an anesthetic risk. There's a procedure-related risk because we're actually using a long needle. This needle is actually nearly 1.5 feet long.
1.5 feet long.
It's
Okay.
pretty long. That goes
Okay.
through the lady's vagina into the egg,
All
and
right.
we aspirate these eggs out. So
I
there's
see.
always a risk of infection,
Of course.
bleeding, those type of things. And obviously after the procedure is done, then what happens, we do this, as I said, this embryo transfer,
Right.
and subsequent to that we give her medication for the support of the womb. So during this whole period she could have this hyperstimulation problem where she could feel bloated.
True.
She could be having infection setting in. Those are things that can
Yeah,
that we will
as with
actually
any
monitor
other
through.
surgical procedures.
That's right.
Yes.
That's right. So
All
all
right.
these are actual risks that can
Okay.
happen. So it is not that IVF is without risk. IVF
True.
has got its own set of risks.
Exactly.
And this is where we actually spend time, all right, and we counsel the couple on all these possible risks.
Step by step.
That's
true.
right.
Because I think, the public face of IVF is quite, I would say, prejudiced by what we see through pop culture. For example, I think we see a lot of celebrities in the public arena, maybe, for example, Jennifer Lopez and etc., who they decided to have children later in life, and it's a common known factor that, they had IVF and boom, suddenly you've got a pair of twins.
That's right.
So people seem to think it's, it's like clock in and clock out and you've got a baby. So as Dr. Kanappan has been telling us, no, it's not really all of that simple, and it actually involves like a huge, really divisive sort of step-by-step procedure.
That's right. It is a bit complicated, but we have tried to make it as simple as possible so that the patients understand what is it all about.
Right.
And we actually work as a team. That means I'm the clinician, I have the embryologist, and I have my fertility nurses.
Right.
All right. And my fertility nurses actually carry a handphone contactable 24 hours.
I see.
Okay.
Okay.
So my patients can actually call in any time to my nurses, seek advice, because you're not too sure of so many things.
That's
so
right.
you can call at any time and find out further details. So we work as a team.
Right.
And this is where we actually help the patient through the whole procedure.
Right.
And try to make it as smooth as possible.
All right. Okay. Good to know. And now, what about the cost implications as well as the future and current situation of IVF, the industry itself in Malaysia? Okay. Tell us a little bit about that.
Now, the cost implications, obviously, because the lab consumes a large proportion of
Yes,
investment,
indeed.
as I had highlighted to you before, and therefore there is a significant cost involved. Most labs will cost between $0.5 to $1 million to set up.
All right.
All
Just the
right.
initial.
Just the initial investment. That is including all these highly trained staff that are involved in it.
Yes, of course.
So if you look at a private sector, the cost of IVF could be anything between 12 to 15,000, some even more, 20 odd thousand.
Right.
The government has been kind enough also to establish IVF centers in certain major hospitals.
Right.
And one of it is the place I formerly worked in, that is Hospital Kuala Lumpur. The other is in Alostar, Terengganu, and in Sabah, Likas.
Right.
Here, approximately, it's around 4,000.
Okay, all right. So basically a fraction.
A fraction.
But that is still
there is still a
considerable amount.
cost
Yes.
because everything is expensive.
Yes, indeed.
If you look at the drugs you're using, they are expensive drugs. If you're looking, as I said, the lab itself, the cost, there's cost implications.
That's right.
So if you look at it per try, that means, as I said, 35 to 40% success rate,
Yeah.
and the
So
cost would
basically,
be around.
you could approximate that is just the initial investment.
That's right.
Okay.
That's right.
All right.
And if
Thank
it
you,
doesn't
Dr.
work
Kanappan.
out, yeah.
So we'll come back shortly after the break to discuss a little bit more deeply about IVF and the future implications for it, especially within the Malaysian context. Stay with us.
kasih. Sama-sama.
Terima kasih.
Sama-sama.
Terima kasih.
Sama-sama.
Terima kasih.
Sama-sama.
Terima kasih.
Sama-sama.
Sama-sama.
Satu cerita, satu bangsa, satu Malaysia. Menongkah batasan masa, mengupas isu semasa, menjadi saluran pelbagai suara. Segalanya baru dan benar di Berita Bernama TV.
Welcome back to The Nation. You're here with me, Tamina Kausji, and today our guest for the day is Dr. Kanappan, who is Fertility Director at Sunway Medical. So as we were saying, Doctor, the cost implications of IVF are considerable indeed.
Correct. But as I told you, we are unable to avoid it. But if you were supposed to compare with all the other centers in this region, for
Right.
example, Singapore, etc., so obviously we are definitely very much more competitive in
Right.
pricing in that way, and probably because of the exchange rate and everything else, we actually stand a very good chance when it comes to health tourism.
Right, that's true.
To cater for our neighboring countries, including, as I said, our patients from Indonesia,
Yes.
Maldives, and all these places where they actually come and seek treatment in most centers in Malaysia.
Exactly. So the cost issue of it aside, let's talk a little bit about what types of there are definitely controversies involved with the application of IVF as with any other medical procedure.
Correct.
So one of the common ones, of course, is oocyte donation. So could you elaborate a little bit more about that?
Now, as I highlighted to you earlier before, when a lady's age biologically catches up, example, if she's at the age of 45, 46,
Right.
and I'm sure you've heard of circumstances, you could have heard of circumstances where ladies at the age of 60, 60 something conceiving, there was this elderly couple in India, I think the lady was at
I
the
think,
age
yes,
of
it was in the
68,
news, yes.
that she conceived and she had a child. So obviously people will turn around and say, she's menopaused, how should she conceive?
True.
So she probably were using someone else's eggs.
Okay. All right.
So this comes to the issue, like in certain countries it is accepted, where once the lady's age biologically has caught up,
Right.
they automatically will offer the patient whether they are keen to use a younger lady's
I see.
eggs.
Okay.
Okay, because the pregnancy rates are very much better.
Of course,
Okay.
naturally.
So this is very controversial in our country due to various cultural religious regions.
Yeah, sensitivities.
So, sensitivities are there.
Yes.
So therefore, in government hospitals generally we do not offer such services where donor oocytes, donor sperms, or surrogacy is definitely not an option. All right, and we always tell these couples when they come that they have to use their own gametes
And their own, yes.
That's right. So that is how it is practiced. certain private centers, I think they do offer services,
right?
But there's a lot of things that they actually need to discuss with these couples, and they usually get a legal input into the whole matter.
Right.
All right. So it involves a lot of counseling.
Yes, before they take
this step, because there's a lot of other implications involved.
That's right.
That's right. So basically, these couples who are seeking such treatment, they really have to speak to their fertility specialist,
right?
And look into all these aspects first. All right, and I'm sure the fertility specialist will advise them accordingly.
That's right, because as we said earlier, it's not just a 9-month commitment.
That's right.
It typically speaking, how long is it between, let's say, the first appointment and a couple who ends up actually electing to do IVF and their conception? Typically, what's the time frame involved?
Now, if you look at the time frame involved, as I told you, first when I do see them, all right, I will actually assess and see what are the issues involved. If they are having issues like morbid obesity,
right, for example,
obviously it's going to take some time, because I would insist that they do lose a proportion of the weight. It's not that lose all the weight, but a proportion of weight to improve the chances of success rate. But we find that they do not have any comorbidities. They are both a very healthy couple,
right?
And they have been trying maybe for 3-4 years. They've done IUIs and all that before. Then we could actually do the IVF in the subsequent cycle itself.
Right.
That's right. So it probably depending on the couple. So the earliest could be done is the next menstrual cycle, or the latest would depend on the comorbidities that are involved.
That's right.
Now, as I told you, 1 in 3 will conceive. So probably there's a good chance, 30 to 40% will conceive in that cycle.
Right.
And if they have conceived, that means 9 months down the line, hopefully they will have a healthy child.
So typically it takes at least a year and a half.
Correct, before they could actually have their baby. That's
all right.
That's right.
Okay. Now, speaking about the future of IVF and its current market position within the Malaysian medical industry, how do you see it? Is our market saturated, or is there room for growth?
I still feel there is room for growth. Okay, quite a lot of IVF centers have set up. All right. But still, there's room for growth in the sense that there's more and more development that is coming by.
Right.
Okay? Things that we can offer, things are like PGD. What we do is PGD. This is pre-implantation genetic diagnosis.
I see.
Okay, that means we have an embryo which is day 3. It is 8 cell, and from that 8 cell you can actually take out 1 cell.
Right.
Okay, and do genetic study.
I see. So basically, to make room for any sort of genetic, disorders or maybe diseases that the parents carry.
Correct.
Okay.
So we can help such parents. We also can make sure that the embryos do not have these genetic issues before we implant. And it takes at least 48 hours for the report to come back.
Right.
So day 3 embryo, day 5, we already have the report. We know embryo A is like this, embryo B is like this.
You basically have a diagnostic profile of each embryo.
Okay. And then
fantastic.
we can choose to transfer these embryos.
I see.
There's also other advanced things coming up in the sense that to improve implantation itself. We call it laser assisted hatching, where the wall of the embryo it's thinned out using laser, and then nowadays most of us do a day 5 embryo transfer. That means it's gone to a very advanced level of development before we actually transfer.
Any reason for that?
Okay, we personally believe that the more advanced the embryo is, the higher the implantation rate.
Right.
Okay. So in those days we used to do a day 2 transfer, because we found that these embryos, you keep them outside the womb, all right, they don't survive. They don't survive that well. But now our labs have improved so much that we are able to achieve up to day 5.
Right. So the viability is almost maybe doubles or even triples by the time.
The chances of pregnancy goes up very much higher.
Right.
That's right.
Okay. So basically that precludes the need for subsequent treatments if it's successful.
That's right.
Okay. Very all right. Okay. Good to know. So basically, again, just to reiterate, the perspective might be Malaysia is a really, a young country, a youthful one. On one hand, we've got, the issue of teenage pregnancies, and it's almost rampant. We've got one of the highest rates within our region especially. And on the other hand, you've got fertility centers, fertility treatments, and etc. So how do we how does one explain that to the layman? What's the need for it?
Right. Obviously, we are reaching a developed nation status.
Right.
Economically as well as the other issues which are related to it. And as I had highlighted before, the importance of career, late marriage that is coming in. So I have a lot of couples where you would consider them as an ideal couple to bring up a family.
Right.
And
there
here they are, they tell me, yes, you see people throwing away babies and all that, and it's so disheartening for them.
Exactly.
When they have been trying so hard to conceive. And if you as a person look at it, yes, this is the ideal family. You actually want them to bring up their child.
That's
you
right.
probably could give all the best to that child.
So basically, IVF, what it does is it maximizes the potential for these ideal families.
That's right.
All right.
That's right.
Wonderful indeed. So thank you so very much for your time, Dr. Kanappan.
Thank you very much.
And you've been here on The Nation with me, Tamina Kausji, and of course, Dr. Kanappan, Fertility Director of Sunway Medical. Thank you so much, and we hope you learned a lot from our IVF special today. See you next time. Bye-bye.